Before the lunch, the session is of Dr. Padmanabhan Shekharan. Dr. Padmanabhan Shekharan would be talking about zero gravity training, what is possible. The session would be chaired by Dr. Sri Raghunath. I would request Dr. Sri Raghunath to kindly come up and take the chair on the dais. Welcome you, sir. Dr. Sri Raghunath is a Dean S. Vyasa School of Physiotherapy, Bangalore. He is consented to be the chair for this session. I would request Dr. Sri Raghunath to kindly introduce the speaker.
Thank you, madam, for that nice introduction. It's indeed my proud privilege to introduce Dr. Padmanabhan Shekharan, the resource person of the day. Dr. Padmanabhan is a specialist physiotherapist with 25 years of tertiary care, orthopedic and sports rehab experience. He is a clinical and administrative leader with 10 years of leadership experience handling the rehab services vertical of major hospital group. He is a visited consultant for Emirates Healthcare Providers UAE. He is an international educator with over 195 workshops and CPD programs delivered across multiple countries. Also, he is invited faculty for national and international orthopedic and sports medicine, orthoscopy and physiotherapy conferences across the globe. He has published, authored with 25 international peer-reviewed publications, which include Journal of Orthoscopy, Journal of Shoulder and Elbow Surgery, European Journal of Orthopedic Surgery, International Journal of Orthopedics and Cochrane Review Protocols. MedEd entrepreneur and physiotherapy futurist for tech convergence in rehabilitation. As I said, it is my proud privilege to introduce Dr. Padmanabhan Shekharan. Sir, over to you.
Okay, guys, good afternoon, and thank you, the Dayanand Sagar team, for having me here, the Vinod and team. Yeah, you know, Bangalore traffic, it took some time, but I appreciate we have put together a beautiful conference with so many speakers, and I'm really happy to be among one. I'm going to talk about zero gravity training. Primarily, we use the only way by which you use the zero gravity now is by a zero gravity treadmill. We have one. We thought we will share the experience with you guys. So there are three parts to my talk. The first one, I'm going to talk about the technology. Obviously, this is a technology conference, so I'm going to talk to you about the technology, the zero gravity, and then how do we use it, the clinical applications in terms of what the technology kind of tells what is possible. And then we'll also share, we have been using it for some time, so we'll share what are we able to do with this. Hopefully, it will provide you some inspiration into taking now. Okay. Okay, before we start, I'm sure everybody has heard about this. You know, Newton discovered gravity. Good news, gravity was always there. Yep. So he just found an interesting way of, you know, looking at an apple, that's all. What actually Newton did was this, okay? He defined the laws of gravity, okay? So he defined the laws of gravity, that's what he did. Okay. Of course, I'm in an engineering campus as well, so I won't pretend I know them. I actually don't know the laws of gravity, okay? What I know is very, very simple, which is relevant to whatever we are doing. What we know is everybody here has got a mass, every object has got a mass, that means inherent to its material, it has got some mass, okay? That's what it is called. And then when you actually measure the mass against the gravitational pull, it's called as your weight, okay? And we are all obsessed with weight, is it not? Body weight, okay? Weight and all that stuff. So that's the relevance of gravity, okay? There is nothing as a human being in Earth we do without the reference to gravity. Just imagine this. Good. Physiotherapy, everything is about weight, is it not? Yeah. Just imagine this. We all have dumbbell, we have resistance, but then this is all about weight. I have an interesting question to ask you guys, okay? If you are not very hungry and not busy talking to each other, probably you can think about this. If we take off the marker, okay, you can see that the dumbbells are of same shape, okay? The dumbbells are of same shape, and then obviously they are of different weight. and for some reason, if we don't mark them, okay, and then put it in a physiotherapy department, would any physio or anybody for in a gym, wherever, would you be comfortable picking them up and then prescribing based on which one comes first, which one comes second? How good are we, okay, when it is not marked? You want to know the relevance of this question? Yes, no? Yes? No? Okay. Yeah. Because we made it easier for us to, okay, define and classify gravity, but the gravity is all around us. And if you have an ability to use that as a gravity as a prescription, then you can redefine what we do. So that's essentially what I'm going to talk about. So when we talk about, clinical applications, we are talking about how do we use mass or how do we use weight, and then we call in the clinical terminology as load, okay? So of course there are various definitions to load, but here the load basically means the weight, which I showed you. It can also means resistance. It also means how do we use gravity, okay? This is something which I have added now, okay? Why do we have to use it? Because you want to make sure something adapts. That means you use weight to lift, and then your muscle become bigger, stronger, okay? You use your body weight, and then it becomes, you get good at some of the movements. Same way, if some structure is injured, okay, you use weight and resistance. We know the TheraBand, the blue TheraBand, which we tie to one end and then pull, okay? Yeah, that one. So you use weight to also give what we call as biological and mechanical cues. And then if you give biological and mechanical cues to the structure adapts to it, okay? This adaptation is what actually we use to basically address a dysfunction and also facilitate repair in tissue, okay? So that's why it is important for us to prescribe load. So we also gotten a little better at prescription of load, because we know that each structure can adapt a little different to different type of loading. For example, a muscle, tendon and cartilage. So you have the knee joint, okay? You have the patellar tendon, you have the patellofemoral joint, and then you have the patellofemoral cartilage, okay? And you know that a same exercise, if it is prescribed in a different level, it can be directed towards the cartilage or a tendon or a joint adaptation. I'm sure you guys are learning about it, okay? Because the diagnosis, what we treat knee pain, but if you are able to prescribe and then treat patellar tendon pain as opposed to just knee pain, your treatment is going to get better. So how do we use resistance or load as a prescription? If it is healthy, you want to improve performance. If it is injured, you want to get it back to performance, or you take care of pain. You want to adapt, so okay, you want the structure to adapt. Somebody who has a patellar tendon problem and then he wants to do something like, jumping and landing, which is part of basketball. Somebody has a patellar tendon, but he wants to actually kick a football, generate force, different adaptation. Somebody has a patellar tendon and then they want to drive in Bangalore traffic. Somebody has patellar tendon and then they just want to sit. And then, these guys, physiotherapists. Here? Yeah? No? Okay. So what are the adaptations? This is defined by what are the functional demands. So the load has to be different. The prescription has to be different. The way we prescribe load is like this nowadays, okay? It is easy for us because you have different levels of resistance and they're all marked. I gave you have a barbell and you know how much is the weight of the barbell. And when you do a squat or when you do a deadlift, the aspiration is for you to do, say, for example, I want to do equivalent of my body weight. I'm a 60 kg man and I want to do a 60 kg barbell squat. Easy to measure, easy to progress. You also want to do it for different, resistance and all that stuff. But if you're having somebody who's actually running, okay, or somebody who's, in your biomechanics book, you would have read actually about prescribing load in terms of, say, climbing up and down the stairs. So it says about 8 times your body weight. It doesn't say how many stairs. If I do it for half an hour, it's different. If I squat, it's 4 times your body weight across your knee. So you can measure with gravity or the load by using the proportion of body weight or with the external resistance. Now what I'm here to talk about is fundamentally change the way you define load prescription, okay? So the load prescription, if you have taken the gravity off, okay, then if you are prescribing it in zero gravity or a microgravity environment, then the prescription is completely different. Only if you understand the concept of load prescriptions using resistance, then you will understand the concept of how do you actually take the load off and then reintroduce for specific adaptation. That's what I'm here to speak about. Yeah, I hope. So this is what we use. We use a R-force, BTL R-force. Okay, this allows us to offload a 135 kg man to almost zero body weight. Okay, it literally lifts this guy 135 kg man, and you can do 100% body weight. There are very few in the country. There are only about 5 or 6. We have one of them. We are fortunate to have one, and then we're able to do some actions, meaning. So the action of mechanism of action of the zero gravity is very, very simple. It looks like an air-filled chamber. Okay, it fills the air, fills it very fast, and then lifts the man up. Now that is not where the technology is. You know, the technology is like this. When you're actually lifting somebody up, you can measure how much is his body weight. But when he is moving in air, that means the person is actually walking, squatting, jumping, landing. Okay, and and then you are modifying your parameters in terms of I want 50%, I want 30%, I want 60% of body weight. For every change in the action and for every change in the parameter, the air pressure changes automatically. Okay, that's where the technology, that's why it is super expensive. Okay, it's a 1 crore piece of equipment. So you are able to, it's called as the differential air pressure system. So it is able to sense the change in the movement, it is able to sense the change in your action, and then you can also prescribe the zero gravity or the microgravity as a load. Now quickly about the technology, you can achieve unweighing, and then you can change the speed of walking. The machine that we have allows somebody to run at the sprinting speed. Okay, so you can run at a sprinting speed without load on your leg, and it has some applications. I will show you what they are. And obviously it has other applications in terms of you are able to have a real-time feedback on somebody who is actually having no feel of how to load the leg symmetrically. I'll give you case examples. Okay, you show them the feedback, you all know about the visual feedback, and then you keep the environment changing, and then what it does to the gait is phenomenal. Okay, and we have some case examples. And that's all about the technology. And of course, you will be able to get the gait symmetry. Okay, the treadmill platform has got a sensor which will actually measure accurately the step length, the length, the speed. It also gives you how much load you're putting and then how much symmetry. As you can see, this is an example of, okay, it doesn't work. Yeah, okay, this is an example, you can say 48 centimeters of step length symmetry. And then it also gives you step width symmetry. Okay. And the best part is when it integrates both and then gives you something like that. Okay, the change in center of pressure when you take step and when you take multiple step over time. And if you are able to get that butterfly pattern perfectly, then your step length, step width, and your swing phase, everything is integrated perfectly. Okay, for someone who has had changes in load and deviations in gait, this is just a game changer. Okay, and then we are able to show them objectively how to achieve this over time, and then how we can tweak the gravitation, the unloading or unweighing, and then get them to gait symmetry first, and then reintroduce the load, and it has done wonders for us. So there are preset protocols. Obviously, you can make somebody walk very acute. So we have made somebody after say orthopedic procedure like a high tibial osteotomy to walk as early as 4th week symmetrical gait with the offloading. So unweighing here, you can see the prescription will be about 65%, and then you can increase or decrease the loading. There are set protocols. There are set protocols for this. You also have return to play protocols. One of the best thing about the machine that we have is it allows you to run as a sprinting speed, as I said. So somebody who is recovering from a bone stress injury, we have managed to get them running at a marathon speed, okay, as they were recovering. Otherwise, it was rest, okay. And then here, we are actually keeping them running throughout. So that's the implication. So the progression for speed is different. The progression for endurance is different. The progression for strength is different. These are preset protocols. But then when you put the load symmetry, and then you have too many options for you to actually prescribe and then progress these loads. Then comes the weight loss, which is not something which we use. But then in terms of clinical application, we found that this is something which is actually of a huge impact. You know the prescription for somebody who is with a ONE, okay, who is weighing heavy and ONE, not able to walk. You know what is the prescription? Okay, don't climb stairs, please walk and reduce weight. You understood? And how? Okay, and then we prescribe isometric quadriceps, resistance, and then diet. Nothing is going to work. So that is where this comes in. So you are able to take somebody who is overweight, and then you are able to make them walk at a normal or even an exercise walking speed, because you are taking the load off, and you are able to do it at least 3 times, 4 times in a week. Okay, and then you see their body weight changes, you see their strength adaptations happen, and then it completely redefines the way you are actually treating somebody with lower limb arthritis. Okay, and you will be so surprised how much it means to the patients. Okay, it's actually, that's why the 135 kg unweighing is very important. Okay, because you will be able to lift that heavy man, and then 100 kgs and 90 is very easy. Then it does significant clinical, it adds significant clinical value. Okay, so this protocol especially. So there is research, there are research. Now as you can see, the research is fairly recent, because not this technology has been around for some time, AlterG has been around for some time, but it has its own limitations and all that, and primarily nobody understood how much you can use it on the clinic, and it was restricted mostly for sports rehab of an elite athletes. But right now we can do much more than that. So there are papers, and you can see it is 2022. This is post-op patient, 1 year follow-up, and then it says about better gait and then muscle atrophy. Because you are engaging the muscle and then you are engaging them in functional activity, you are able to prevent your muscle wasting, because they are working through the function, and you are able to get this. And you also have studies which say about using it on total knee replacement, meaning we use it on TKR patients who come with a loading symmetry and then a gait deviations, and then they are really getting better. I told you about the step length and step width, and then the butterfly walking pattern with symmetries, integrating the stance and swing phase. It does wonders for these patients. Then comes, there is a comparative paper, again 2023. So they have used it on hip replacement patients. So we have used it on patients who have had avian surgeries. The avian surgeries, by the time the patient goes in for a surgery, already he is limping, okay, for 2-3 years. Okay, his gait pattern has changed. And then the surgery, you do whatever, if you do core decompression or you do replacement, whatever you do, you're going to take some time for you to restore that symmetry in gait, because you've forgotten. Okay, gait is more about your memory, is it not? You've forgotten. And irrespective of how much you train your hip abductors, how much you train your walking stance and balance, there is value, but then for it to integrate into function, it takes quite a bit of time. And then here we are able to do it pretty quick. Okay, we do use in a lot of avian patients, a lot of hip surgery patients. And yes, of course, post-operative injury patients. One thing that happens in post-operative cases is you have this deconditioning effect in your body, because you are walking with your walker, you are walking with your crutches. How much do you walk? Do you walk as an exercise? You don't walk as an exercise, you walk for your function, is it not? And that's about 6 weeks, that's about 8 weeks, sometimes it is 10 weeks. And if you're actually not having exercise for that period, then the deconditioning effect sets in, and then your complication sets in. So here you are able to offset the deconditioning effect. So there are changes in your metabolic parameters as well. And this is something which we found. The question obviously remains that human beings are designed to walk, you are supposed to run, and then you are running over ground, and then here you say that you are able to lift up, offload the gravity, and then run. Does it have the same effect? Okay, there somebody has studied. And when you can, because that's the advantage of the new age treadmills, because they will be Okay, guys, I will appreciate if you can talk a little less among yourself. Okay? Okay, thank you. So, you will be able to improve the sports performance of somebody running at a sprinting speed and then keep the performance. I have a couple of case examples of this. We are learning this because there are no textbook which are saying this. We are learning this. And then it has done wonders for our patients. I'll tell you the examples. So it is possible for you to run in a microgravity or a zero gravity environment and then enhance your sports performance. This is actually a game changer. This is actually a game changer. So those are my case examples. Okay. So this is a patient who came to us with post-op TKR, and because it is unilateral, she had difficulty getting gait symmetry, walking, and then she had something very, very specific. She came to us 6 months post-op. Whenever she has to walk on uneven surface or climb down, she wants to trek, okay, climb up on an uneven surface, she has difficulty, and then she's just not getting the symmetry. So we put her on the protocol for gait symmetry. You can see that she still has a varus on the left knee. And then we were able to get her gait symmetry, walking uphill, and then improved walking endurance, ability to do exercise, walking as an exercise for a longer time. Okay, those are the things that we were able to do. This is an example of post-op. You know what happens in a tibial condyle fracture, is it not? 3 months to 6 months, you are actually not able to load the limb, and then by the time you are able to load the limb, okay, you realize that you are actually not symmetrical, and then it takes about 1 year for you to recover. Here, we are able to get this guy to do this, okay. See what he is able to do? He is able to run after a tibial condyle fracture. 6 months post-op. You know why this is important to him? Can you see him? He is a little obese, okay. And then you keep him grounded because of the knee fracture for some time. The guy is going to get more weight. And you all know that when there is an articular fracture, tibial condyle, you are going to also develop early onset of osteoarthritis, and then you are going to add weight to it, and it's going to be detrimental, one fracture. So that's the advantage. We are able to give him a healing stimulus, get a loading symmetry, and then able to make him run faster and then lose weight. This is somebody who had a patellar fracture, and he came to us 9 months after patellar fracture. You know what patellar fracture does, is it not? He also developed chondromalacia and absolutely zero ability to climb up and down the stairs. Okay, and then here we are able to prescribe him a single leg squat. Okay, and then we are able to offload and then progressively induce the load, and the guy is able to climb up and down the stairs normally. A lot of time it is mostly the inhibition and then the lack of movement and the inability to load that causes this, and we are able to restore this. This is a phenomenal story. And this is something which is emotional and close. The man is very big, okay, and as a cervical myelopathy, with him walking for the 2 years, he wrote a very emotional LinkedIn post, okay, and his walking, if you see over ground, I don't have a picture, he needs support of 2 people to walk, and then takes a very small step, okay. We were able to put him on this and then give him that butterfly pattern, okay, step length, step width, and loading symmetry. He was literally in tears after this. And this is an endurance runner. The guy finishes, if you Google him, you will see almost in every marathon in the country, this is the guy who finishes first on the podium. He is a 10K, every TCS 10K, he is on podium for the last 3 years. He tried to transition from the 10K into half marathon at the same speed, okay, at the same speed. Guess his speed of half marathon. His half marathon is 1 hour 13 minutes, okay. That's fast. Most people run a 10K around that time, okay. And then he developed a stress fracture of the fibula, okay. And he has, when these guys run, they run multiple events in the same year, every city, and these are all brand ambassadors. So we were able to keep him his running stride and his running speed throughout the recovery of the fracture, okay. He doesn't feel the pain of the fracture, and then we obviously did something for the fracture as well. We are equipped to deal with it, bone stress injury, and then we kept him striding. The guy finished on the podium. He in fact got his best timing okay, recovering from this. Took us 10 weeks from a stress fracture of the fibula. The guy was on the podium, okay, and he wrote a beautiful Instagram story on it. And this is the latest we have seen. So, young 14-year-old female, okay, sprinter, national level sprinter, overtraining, came to us with a navicular bone stress fracture, navicular, okay, and career done, okay, immobilized and all that. She had a national, she has been traveling, meaning she has been training for this national event, Junior National Athletic Championship, which happened last month, for her lifetime. And then they put so much, and then you see the MRI, and then people think that, okay, you give up your running career forever, okay. And then we took her, I think the coach has written a post, okay, it took 40 days, that's what she says, okay. We took about 7 weeks, and then that's what she was able to do, okay. Can you see that? So the treadmill allows you to run at that speed with an offloading, and then she won a silver, okay, and she won a silver, and she won a gold, 2 medals after recovering from a navicular fracture. So it is possible, okay. We also have grade 3 avians, where we are able to increase their walking distance. We have fractured femur neck. This patient was very interesting. You know, when you see patients with femur neck fractures, which is fixed, and then you see them walking with a 10 lumbar gait, and then you are trying to, you know, improve their hip abductor strength, but because there is a screw, there is only so much that can be done. And then this guy also had a delayed union. That means 6 months he came, the fracture line is still not united. And you all know when we load a joint, when we load the bone, you can unite, okay? We didn't actually start with the goal of, you know, fracture healing. We only wanted to normalize his gait, because when you are walking with the 10 lumbar, when you have pain, there is only so much you walk. You walk about, say, 500 meters, okay, or about 1,000, 2,000 steps in a day. And then here you put them on a loading cycle, and then you make them walk at least half an hour to 40 minutes, okay, and then do it repeatedly, at least 2 to 3 times in a week. And we were surprised, the surgeon was surprised, that the fracture actually united, okay, in 4 weeks' time, okay. So the healing stimulus can really make a difference. Ideally, I should have gotten the X-ray. We also have an international tennis player who cannot be grounded. She plays at a very high level. Tibialis posterior tendonitis, we are able to keep her load. The load management is completely redefined. We were able to keep her running throughout her rehab process, okay, while she was hardly able to do a single leg heel lift. We also have a patient with a calcific tendinopathy of an Achilles tendon, senior runner. He runs a running group. He is very highly respected. He runs a running group he trains most of the marathon runners who finish on podium. He himself finished on the podium in every race. People are looking up to him. Calcific tendinopathy, bilateral. His goal was very, very simple. I don't just want to imagine somebody is limping, and then he says, I don't want to just run. I also want to keep my time. Okay, we were able to do this. Okay, we also treat quite a bit of ankle injuries with osteochondral defects of the talus. We have a case series of 12 patients actually on just this one. So that's essentially what was my topic. So zero gravity training, what is possible? Actually quite a lot. And that is what we use, the R-Force. It's a cutting edge rehab technology, and the future health is already here. Thank you. Yeah. Yeah, 8 minutes. Okay, thank you.
Thank you, Dr. Padmanabhan, for its insightful information on zero gravity training. I just have one question here.
Yeah.
With regard to how soon an athlete can get back to this zero gravity training?
Day one?
Day one?
Yeah,
wow.
yeah.
Okay, right.
It's possible.
Excellent. Any questions from the audience?
Yes, sir.
Good afternoon, sir. Thank you for being with us and giving this wonderful talk. Of course,
my pleasure.
as you said, it's a new field where not only sports, even other rehabilitation centers are exploring these possibilities. Of course, you said these instruments can give a lot of objective values.
Yep.
Yeah, but one thing which probably I don't know whether the studies are there or not, we say that our muscle actions are largely influenced by the gravitational force, right?
That's what we believe.
Yeah.
Okay. It's not zero gravity, it's a microgravity.
Yes.
That's what it is. The
So,
prescription is microgravity. Yeah.
I would like to know whether how could be an muscle recruitment happening inside this controlled environment, sir? Thank you.
Good question. Thank you. Okay. The answer is very, very simple. Okay. When you have injury to any part of your body, what does the muscle do? What does the muscle do? It works or it inhibits. What does it do? It inhibits. Okay. How do you facilitate the muscle? What is the best form of facilitation for the muscle? Okay. You can stimulate, obviously. Okay. It is physiological, but it's not functional. Okay. My quadriceps is adapted to walk and climbing up and down the stairs, and it can recruit the best when I recreate the function. So whenever there is injury or pain or surgery, okay, the muscle recruitment is the one which goes off. That's why the muscle recruitment goes off, your gait pattern changes, your function gets affected, and then you develop long-term physiological changes, including muscle wasting. How do we offset it? By reintroducing the function faster, okay? And that's what it does. In fact, it actually recruits the muscle faster. That's what we are learning, and that's what the research supports in terms of muscle recruitment, metabolic, and then movement memory. In terms of running, the running form is actually better because when you reintroduce the load. So that's what we are learning. It's going to change the way we actually prescribe. 26 years, I thought I knew things, okay, and then technology came and did something else, okay, and then we are very fascinated that we did something like this, and then every day is a learning, okay. That's what I'm here to share. Yes, ma'am.
Hello. Yeah. Thank you, Dr. Padmanabhan, for a very interesting talk. This is something which we had not heard about.
Yep.
So you're telling that zero gravity, microgravity thing. Will it not, like, you're telling from the day one you can put the person onto this microtherapy or this zero gravity training. So the healing or something is not at all affected by
no, that's what I'm saying. Load is a healing stimulus. That's what I changed. I started my slide with it, okay. So load is a biological and mechanical cue for healing. There is a very famous dialogue. The guy who actually, how many of you know who is Philip Glasgow? Do you know Philip Glasgow? Okay, how many of you know the peace and love protocol? Okay, heard of the terminology called optimal loading? Okay, so the optimal loading basically means that you don't immobilize the structure, you start loading it so that it recovers faster, and there is enough science with this, okay, in this field, and there is a 2015 paper which is explaining, and his dialogue is very, very simple. When you ask this question, when do you want to load, okay, he says day zero, moment zero. Day zero, moment zero. That's essentially what is the prescription for load. Obviously not for fractures and not for unstable injuries and all that stuff. But then there are ways by which, for example, you can immobilize the knee and then still do what we call as axial load. So there are ways for you to start loading for a healing stimulus. Okay, it does heal. Please. Okay, my pleasure. We done?
Yeah.
Okay.
Any more questions? Thank you. Thank you so much. Thank you so much, Dr. Padmanabhan, for this wonderful presentation.
Yep.
Thank you.
Thank you. Yeah.
Excuse me, sir. One more question.
Yeah.
Sir, when you are the patient is taken in the anti-gravity or microgravity environment, I wanted to ask about what happens to the circulation.
What happens to the?
Blood circulation.
Yeah.
In normal gravity, what happens is when we are running, our calf muscles just pump and the venous return happens. But what happens in the zero gravity? Is there not blood pooling or is there pressure variance?
No, nothing happens. Okay, it stays exactly normal. That is the best part of the technology. I told you about the differential air pressure system. I told you about the differential air pressure. As your body moves, the air basically changes so that it really does not really apply a lot of compressive pressure and lift somebody up. That's not what it does. Okay, so it actually changes every time you move, and that's essentially what is the ingenuity of this technology. So the circulation, we also had these reservations. For example, you put somebody with say hypotension. So you put somebody and then you lift them up, whether there is pulling of the circulation or where there is more blood flow to the upper body. Nothing like that. Physiologically, they have measured all of them. It is possible for you to keep the physiological adaptation completely normal by using or changing the air pressure according to the movement. That's essentially what is the technology you should experience. Okay.
Yes, sir. Thank you, sir.
Yeah. Thank you.
Thank you, Dr. Padmanabhan.
Thank you.
Thank you so much for your talk. I would request Dr. Pushpa Sarkar to please come up on the dais. So please be in the center stage. We would like to present you with a memento.
Okay. Thank you. Good. Thank you.
I request ma'am to present a memento and a certificate from our side to Dr. Padmanabhan Shekharan for his contribution to
Thank you
this
for
scientific
having me.
sessions.
Thank you for
Thank you, Dr. Shekharan, for being a part of this scientific deliberations. We would also like to extend our thanks to Dr. Sri Raghunath for chairing the session. Thanks, sir, for coming here and chairing the session for us. Thank you, everyone. Now we are going to break for lunch. So we'll have